In this chapter, we'll be looking at the drugs and drug classes that are used in the respiratory system. Re- Respiratory tract cancer is another thing that we might see, and again, our area sees it a little higher rate than some areas of the country might. Um, it can be found anywhere in the respiratory system, from the sinuses to the lower respiratory tract. Treatment is most commonly going to be surgery, radiation, and chemotherapy. It may be a combination or it may be one of those alone. So it just depends on the type and the tissue type of the cancer itself. Pulmonary thrombosis starts as a deep vein thrombosis, or basically a deep vein blood clot. A lot of times these will be in the leg. The treatment is oxygen to try to get them enough oxygen in, and anticoagulant therapy to try to reduce and dissolve the clot. TB or tuberculosis is an infectious disease that's caused by microorganism, Mycobacterium tuberculosis. There's several drugs of treatment, and please excuse the pronunciation here, but rifampicin and isoniazid, rifampicin, uh, ethambutol, and um, perzenamide, I believe, something close to that. Again, excuse the pronunciation is not exactly correct, perfect there. Uh, so these are the common treatments, with 3 of those typically for 2 months, and then followed by 4 months of isoniazid and rifampicin. Pretty commonly, we in healthcare, especially primary care, we're going to be treating patients for rhinitis, sinusitis, and strep throat. Um, Basically, all inflammations of the upper airway. Treatment most commonly is decongestants to basically open up the passageways, and histamines, which are given to block histamine, which may be sometimes from allergy cause. And then systemic antibiotics, which may be things like the um, penicillins or one of those type of drugs if we find it to be a bacterial cause. Something else we've seen over the last several years uh, in treatment in our area is nicotine dependence. Of course, that's a smoking um, type problem, uh, and it's because of the actual chemical nicotine, which comes from the tobacco. Um, of course, the first thing they want them to do is to stop smoking. So to do that, there are several different drugs that might be used to help them to break that, because it is a addiction type problem. So um, the non-nicotine things, medications, there's gums, there's all those things out there, but there's a nicotine patch, which is Nicoderm. There's nicotine gum, nicotine lozenges, sprays. There's even a nicotine inhaler. Another treatment method that may be used for smoking cessation is non-nicotine replacement things. In this case, it's going more into the antidepressant drugs. Zyban is one of the common ones, but there's actually some others. This is probably the drug of first choice here that they would use for it. Looking at specific medications, we see the antitussive classes. Those are going to suppress the cough reflex, and it's working on uh, the area, the control center for where coughing is stimulated. There's the narcotic antitussive, which that's going to contain codeine, and you can see this in different forms. And then the non-narcotic antitussive is dextromorphine. Uh, and you look at this as in, is it a decision making, is it productive cough or is it non-productive cough? Is it a cough that they're they're coughing just because of side issues, but not necessarily because of something they're trying to remove from the respiratory passages there. Uh, Mucolytics are mainly done to increase the fluid in the respiratory tract to help to um, reduce the thickness or the viscosity of secretions. Acetylcysteine might be one of the drugs used there. Another drug that might be used is decongestant. These are vasoconstrictors used to for nasal congestion, shrinking the mucous membranes that are engorged in this case. Um, Relieving symptoms don't really help to reduce the congestion, and phenylephrine hydrochloride might be used, or Afrin. There's one problem with this group of drugs that we sometimes see with longer term use of the drugs is when the drug wears off, then the membranes actually start to swell. So in this effect, it's a counter effect of the drug caused by long term use of the drug. Antihistamines basically are used to block the production of histamine. They shrink the blood vessels, relax the bronchial muscles, and help breathing by those methods. Drugs we see here are diphenhydramine, or basically Benadryl or chlorotrimazole. Other drugs, and this is more newer generation, are Allegra, and Claritin and Zyrtec. They typically class these as first generation and second generation, and one of the key differences is in first generation drugs, there's sometimes more side effects to those. Second generations, they've kind of worked out some of those side effects. Beta-adrenergic agonists cause the bronchioles to relax and expand, basically opening them up. They are probably the best bronchodilators. They relax the smooth muscle, open the airways, increases the cleaning of the airways by the cilia and mucus. Drugs or drug classes here we see are metoprolol, albuterol, which is used very commonly, isoproterenol, ephedrine, and terbutaline. That is the end of this particular chapter of pharmacology, and I will be sending you information so you will know what to do from here.